Hello, everybody. Welcome to this webinar today. It's good to have you here on a webinar about foster care for children on the move in the Gambia. We'll be starting in just a moment. Just got a few people joining. That's great. Hello, everybody. Welcome to this webinar today. Hello, everybody. Welcome to this webinar today on foster care for children on the move in the Gambia. We're going to have simultaneous interpretation for the webinar in Spanish and in French. There'll be some information about how to join the interpretation channels in a moment. Welcome. On this slide, you'll see some information about how to join the interpretation channels. There's a globe symbol at the bottom of your screen, and if you click on that, you can choose the language that you would like. There will be some parts of this webinar in Spanish, so if you're English speaking, then you can also click on the English channel as well. So that's the globe interpretation button at the bottom of your screen. Welcome, everybody. Welcome. If you'd like to choose the interpretation button at the bottom of your screen, you can do. The interpretation is available in Spanish and French and also in English, as there will be parts of the webinar in Spanish. Okay, if you would like to use the chat function, then that would be great. If you would like to introduce yourself, if you choose select everyone on that, then you can talk to everybody on the webinar. If you'd like to let people know who you are, where you work, and what context you're coming from, that would be brilliant. We're also going to have a Q&A function today. So you've got a Q&A button at the bottom of your screen. If you would like to ask questions throughout the presentation, then please do. There's going to be time for some questions to our presenters at the end of the webinar. It's only the presenters will be on the screen, so you won't be able to speak on the webinar, but if you would like to use the Q&A, that'd be great. And there's also the chat to introduce yourself. That would be perfect. Okay, this webinar today is being hosted by the Transforming Children's Care Global Collaborative Platform. The platform is a community of actors and organisations that are engaged in child protection and care reform. The overall vision of the platform is to establish a more strategic sector-wide collaboration from the global to the local level by coming together and building on one another's work in order that we can secure a greater and more sustainable impact, as well as undertaking joint advocacy. The platform is open to everybody, and there's lots of information available, and you will get information from that platform. There's on the chats, there'll be about how to join that platform. There's lots to be involved with. There's various task force groups on the platform that you can join. I have been co-convening the foster care task force group with my colleague Barbara Bear from Catholic Relief Services, and it would be great if you could join that group if you're interested in foster care. Have lots of good discussions on there. Last year, we had 5 webinars on different areas of practice relating to foster care, with examples from lots of different contexts, and the recordings are available, and we'll provide you with the link for those recordings if you're interested in that. So please do use the Q&A function to ask questions throughout the webinar and introduce yourself. Thank you, everybody, for introducing yourself. Okay, I'm now going to hand over to our moderator today, Jeffrey Ayat. Jeffrey has more than 20 years experience in child protection with Save the Children from a range of countries. He's currently the Regional Child Protection Advisor for East and Southern Africa. He's also the co-lead of Safe and Appropriate Care Technical Working Group, and he's worked extensively on appropriate care in Sri Lanka, Liberia, and regionally in East and Southern Africa. Thank you, Jeffrey. I'll hand over to you.
Yes, thanks, Luis. I'm the host for this webinar. I would like to also start by welcoming everyone who is with us today. And we are going to, as already indicated, we will look at a project on foster care for children on the move in the Gambia, implemented by Save the Children and TDH. Now, in terms of the agenda, we will have a background of ProteGem project and lessons learned. And this is going to be the first part of the webinar. And then we will also go into more details into what it takes and what happened in implementing foster care as an alternative in the Gambia. And in the end, we will have some Q&A. In the middle, we will also have both a presenter as well as a video clip of what exactly is happening in the field. So to start us off, I would like to introduce our first speaker today, Jose Maria Benitez, who is a child protection advisor with Save the Children Spain. Jose has worked on violence prevention extensively in a number of contexts, including Spain, Bangladesh, Yemen, Mozambique, and Ethiopia. He is the technical advisor based in Spain, supporting the project in the Gambia. Jose, over to you now.
Thank you so much, Jeffrey. Good morning to everyone and good afternoon. Thank you so much for being here, present, and also for being interested in this beautiful experience. We do appreciate it and we hope that you enjoy. So we can start, Margot. Thank you so much. So we are going to speak about the Gambia experience itself under foster care for children on the move. This is one of the experience from the fourth that we are going to explain later in ProteGem. So this experience is an alternative to the government shelter, Save the Children, and also to the Terre de Zone, have implemented to improve the protection of children and youth in the mobility of the main migration route in West Africa. This is funded by the European Union as well. Thank you, Margaret. Next, thank you. So we are going to have a small outline where we are going to have a little background, including the pilot experience that helped us to have a learning experience in Serbia. And then we will see a video. Then we will have a context for the Gambia. And then my colleague Aliou, present there, will be explain the approach, a case study in the Gambia, conclusion and recommendation. You can, thank you. So as firstly, everyone knows, children mobility in West Africa is driven by multiple factors, including economical, educational, family environment, domestic violence, conflict, and now we can say that it's on the screen, conflict, climate change, and food insecurity. Why this is important? Because Save the Children ensure to coverage all the main African migration routes, which means the Atlantic routes in Gambia, Senegal, and Mauritania, and also the Central Sahel routes, which mean people from Côte d'Ivoire and Guinea. And this is important for us to highlight because here we can explain two main approaches. One is related with mobility, another is related with protection system. So ProteGem project itself is a project under 4 interventions, as we say there. One in Côte d'Ivoire, another in Guinea, Senegal, and the Gambia. And this allows us to contribute to the creation of protective environment for children and youth on the move, strengthening the capacity and coordination and articulating the institutional actors and the community, and also to facilitate their access to the quality social service adopted at any different state of the migration routes, focusing their need and also in their vulnerability. So this project has a length of 3 years in total in the 4 countries, and it's going to finish next month with extension. And in Gambia, since 2020, The project has direct assistance to 721 children and youth on the move and 251 of children placed in a foster care, and then later reintegrated in their families in the Gambia and the neighborhood countries, considering this is a cross-border project. Thank you. So now we are going to have experience that allow us to focus better in the learning process, and this is especially foster care for unaccompanied and separate children in Serbia. As we all know, in 2015, in the Balkan crisis, Save the Children started to conduct activity to ensure that local child protection system provide a quality central child center service to unaccompanied and separate children in Serbia. And this is allow us to have a protocol later on, 2 years later, formally in the Balkan Migration and Displacement Center with a mandate to improve learning and knowledge sharing about the adequate response to the children in migration. This guideline is for free to use, so we can share. This is a protocol for foster care that has taken many, many lessons that we're going to see now in the next slide. This lesson learned has several elements that we consider really, really important. The first one is target a specific age group of refugee and migrant children for recommendation placement. We had to know exactly why we had to choose this, because we had to understand who are they, from where they come from, why they left their home, and also what have been past in terms of the well-being and mental health status. And additionally, this will us allow to have a good training and to continue to have that support in all the process, because their experience is really important for us to continue in not only at the beginning, at the end, to have a full recovery. Also, we need to understand the cultural pattern in order to understand the values, their identity, the no communication behavior, the no communication patterns, in order to have appropriate assistance and develop a skill in order to gain trust again, because they have been suffering a difficult situation. One of the most important things is to have a good network of professional and foster care to identify where these people can be selected as a foster care family, and also where they can go in order to have the best interest for the child. And at the end, this is really important because this allows us to have a good assistance for the placement where they're going to be. And now we are going to see a video about the Gambia experience. Very, very important, because there you will see all the resources, placement as a child-friendly spaces, testimonies from the foster care families, from the technical actors, trainer, children, and you could also have to see how important and relevant this project has been there, because it will, of course, improve the quality of service, central approach, and also the protection system there. Thank you so much. I hope you enjoy.
Since it was launched in 2020, the Protegym project is committed to creating a protective environment for children and youth in mobility through adapted, accessible, and quality social services. The project is led by Save the Children International and Terre des Hommes in 4 countries in West Africa: the Gambia, Senegal, Cote d'Ivoire, and Guinea. For the first time in the Gambia, a host family system has been implemented in Farafenni, located in the North Bank, and Soma in the lower river regions. A child-friendly space can host children up to 3 nights. These host families serve as temporary placements for children and youth in mobility while durable solutions are being sought.
Children on the move is always a problem here, because when we receive them, we don't have place to place them. So that's always a dilemma for us. Sometimes resources also is a problem, because we have only one shelter for children in the Gambia, that is at Bakote in Banjul. And trying to move a child from here, taking that child up to Banjul, tracing the family, I think with the establishment of these host families have make work easier.
The host family was a way to go because government we are not everywhere to respond to child protection issues. But with host families, they were more than willing and ready to take care of children on the move at their level. The needs of children and youths on the move are many because they need food, for instance. That's a basic need for CYMs. And they also need shelter. They also need medical support. They need psychosocial support as well. So these are basics in terms of response.
So as a project from the outset, we decided not to work with any parallel structures or not to create any parallel structures. We decided to work with existing community structures. And since there's already a community child protection committee in our project operational areas, we use these committees as our entry points. And through the community child protection committees, I gave them the task to do the preliminary identification of potential host families.
Families have been selected based on a criteria that is using the foster care form developed by the Gambia government under the Ministry of Gender, Children and Social Welfare. So we use that form to interview the selected families. So based on that interview, when you pass, you meet the criteria, you are recommended and approved by the ministry itself.
I attended many trainings. And the training is all about how to take care of these children, how to assist them, all right, how to be with them, how to give them social psycho supports and other things. I actually learned many skills after attending the trainings.
Wotumo nyin training manke wato menna nkadindi wala mutabari mbukalo mbe kele nyamen nal bar nkadindi wala muta nke samba police nke smuta nke iftamba radio to kana was do be geni la molle musaje isifilima bar bringim project onata bitum wayenna londo la fa dindi wala maranyato ni amuta fana nyenta marla nyame
nke ma bela no karan kendele ke kanu londo karanja dinno la maranya ni tanko kenya ngo karanja ngo londo sore je demande man jamba ba baranga sore je ba ka anda na palfana.
And we also train with some skills to be able to talk to them, because at the time they are traumatized, maybe they have some family problems or they even have problems from where they come.
Once children and youth on the move are identified by the mobile teams, they are referred to the social workers for more active listening and in-depth assessment of their needs. For example, at the child-friendly space in Farafeni, where children can spend up to 72 hours. When this period elapses without tracing the child's family, the child is further referred to the host family for continuation of care services.
One, we've been giving some mattresses, like beds, to be able to have good spacing for these children. And also they help in clothing, and they also help in feeding. Because, for example, you have your own family, you want to feed them, they bring you 2 or 3 children at a time. That is a plus to your family.
Sola ku follow warin ka da fango nyinin ka na futa ron isa nyinin ka ibota min tole anaka ta min tole ani ala sola ku follow ala balwot, because jama ni konkole kana bor to ani konkole follow kana o sola ku balati fo sport fo ko kola na do moro ya kono fata sa hanyin dile nasi kaja otumo bitum bembato ya doman na ma fo yesai na meta ba fulen na ma fo jannin sinya fo jannin saba hakilo kana doman wala kono
nte bolo bundata janni na tan si nene ni kacha fon mfanansi ila kulu kalangolong problemo e me borende iskaje dindol fanan ka hanyina
doldo masuru akanga ba seni na raja menna nyalla kara diamo late dol falan ni ka diamo ke sen dol falan ka suru aka do ngaji gara kacala kasi ga mol ngeni ka e borana minto ani tul.
Before they receive their kids, that we have to struggle. Sometimes my wife will go even to this second-hand clothes and get a cloth for the individual because they have to wash this other one before we receive the supply from the Farafenya.
As government officials, not only to reintegrate children, but also to monitor and then make follow-ups to see whether those children that have been reintegrated, still the trend of vulnerability continues, or whether they are placed or put into something that will benefit them tomorrow.
Nibesela, o buka diantol falay. Galaf leta ja, dol falan kanaja, fanni katara fiala ja. Ga molje kane eka fwebi sambal. Ifalam buka pare kata, jamabe je buka laf kata.
So replicating this project to Central River region and other regions in the Gambia will definitely help.
Ni imari yaje ko ilefta bulala nyin do ko kono follow isitti minandi asoto isitti minandi asoto bake aketa ko dinning dole bete fanga bulu bang fo dindete fanga bulu bang bari isitti minandi asoto dinningo me yalon ka nate kan andu yalo ne ko ni yaja burtana be damen to boro yalo mu kole yakolata anate kan enyante timino di yala fele ya mutaku ya kono fandi ya bala jato senen andu te kana ni ku ya ku do laka kata bodana kole yala ko oto nana te kan nyanta kontana ko sotle te la karola sotla andu molu fana mankiliya do sine kan asitara daring ya jo sifa fa ya ma kacale ya kacande ya jel yo doli beje ni na kunjare yasina hantilikin dole ni dal o be ka tare ko non bara abetu ta hadama di ngol longale bulu ni mo mara nyanta mo lonnal e timina wadiya.
I hope you have all enjoyed the quite informative documentary we have watched on the project in the Gambia, as well as the introduction from Jose. Next, we will now go and have more details on exactly what is happening at the field level. And I would like to introduce Aliu. Aliu is the project officer for improving protection of children and youth in mobility along the migration routes in West Africa. Aliu, originally trained as a teacher, has over 10 years experience in child protection with a number of agencies. He has worked with SOS, Children's Villages, Child Fund, and the UN as a UN volunteer. He's a great community animator and trainer. And I think he was also in the video. So we are lucky to have Aliu live with us to give us some direct information on what exactly is happening with Children in Mobility Project in the Gambia and the neighboring countries. Aliu, over to you.
Thank you, Geoffrey, for that brief introduction. And good afternoon to everyone in this platform. And special thanks to the previous speakers for giving a background of the project. So just for more clarity on the video, during the presentation, we might be interchanging between foster families and host families. They are more or less of the same concept. The only difference is that the foster family system in the Gambia has been inspired by the Children's Act of the Gambia, which is the main legal guiding document when it comes to the protection of children in this country. And for the foster family system too, the process goes through a court. That is to say, before a child is placed in a foster family, the process has to go through a court for approval. But for the host family system, which is the only difference, this is an emergency case. If we want to wait for a court decision to be able to place a child, then we are putting the child into more danger. So that's why we have this little difference between the terminologies, but they are more or less of the same concept. So other than that, getting into the presentation specific, just as we have seen in the slide, just to give a brief background, the Gambia is a very small country. I think it's one of the smallest countries in the West African sub-region, with a population of a little under 3 million. And we have about 7 administrative regions. But for the purpose of this project, Save the Children project, we are covering only 2 regions of the country. There's the North Bank and the lower river regions of the country. So according to assessments, research that we have conducted throughout the life cycle of the project, we have realized that the Gambia is a source, transit, and destination country for children in general, for different categories of children, of course, including children and youth on the move. And for the Proautism project, let me say, because of the Proautism project, we were the first, or Save the Children is the first organization that was able to develop a care protocol that stipulates the steps of care to children placed in the host families. And this guiding document, which is the care protocol, was officially endorsed by the Ministry of Gender, Children, and Social Welfare. And let me bring to your attention that it is the same ministry that Save the Children is partnering with throughout the implementation of this project. From the beginning, 2020, up to date, the ministry has been very supportive throughout the implementation of this project. So just as we can see, the protocol is based on a series of key principles, which is common to all other child protection endeavors: non-discrimination, confidentiality, and transparency. And of course, it takes into account meaningful participation of children. Just as I said, the project is being implemented in 2 regions in the Gambia, Farafenye in the North Bank and Soma in the Lower River region of the Gambia. So for foster families, as highlighted by my colleague, foster families are a solution for a temporary placement of children. So basically, once a child is identified, that is a child and youth in mobility is identified by either the mobile teams that we are working with, randomly by the community members, or by any other concerned individual, the first thing is to make sure that the child is either placed in the foster family or in the host family, and then eventually the child is moved to a child-friendly space. I'll get into the details. So basically, if a child is placed in the foster family, after 1 or 2 days, the child is eventually moved to the child-friendly space, where we work with professional social workers. And these professional social workers, basically their role is to conduct more in-depth assessment of the needs of a child and youth in mobility. That is to say, they do case management, that is from the identification stage until the point that a durable solution is being found. So this whole entire process is taken care of by trained social workers. And at the same child-friendly space, you also have a government social worker at regional level, representing the Ministry of Gender, Children and Social Welfare. So it is this same government social worker that is responsible for giving placement orders. So in the absence of a court order that is for foster families precisely, we have a government social worker that gives orders for placement as part of the host family system. So in the absence of a government social worker too, we also have some government officials, like we have police child welfare officers who can also give the order for placement of a child in the host family. Just as I said, it's an emergency case, so care services to children cannot wait. So that's why all these government officials have the mandate to be able to give placement orders. Next slide. Okay, so coming to the approach, how the foster families or the host families were identified and so on. Looking at the first step, preparing the path and care protocol with authorities. As I said before, all our interventions with children, children and youth in mobility, as well as the host family system, these are entirely informed by the care protocol, which was developed by Save the Children in conjunction with the Ministry of Gender, Children and Social Welfare. So at the start, the project of Save the Children, we made sure that stakeholders were involved. And we had institutional stakeholders, such as the Ministry of Social Welfare, the Ministry of Gender, Children and Social Welfare. And we also had the Ministry of the Interior. We had the National Agency Against Trafficking in Persons. We also met National Legal Aid that provides pro bono legal services to children or anyone in need. And we also had meetings with community actors at regional level and at local level. So the very purpose of involving these stakeholders at various levels is to ensure ownership of the interventions at the beginning of the project. So first, we had meetings with the Ministry of Gender, Children and Social Welfare, which is the overall coordinating ministry in terms of child protection. And this meeting culminated to the signing of a memorandum of understanding with the ministry. And as a result, from the start, the project had been able to work with all the structures under the ministry, both at national level, at regional level, and local level. And this includes social welfare officers at regional level, as well as community child protection committees. So we also developed a care protocol, and this was very participatory. We had inputs from different child protection stakeholders. We had inputs from the ministry itself, and this takes into account the various guiding principles when it comes to the protection of children, best interest, and so on. Then the second step was the identification of host families with and within the communities. Again, introductory meetings we had with the community representatives. Just as in the video, they were given the task to identify interested families, volunteer families that could play host to children on the move. Next slide. Yeah, so families were consulted, a number of families were consulted, and we did our own assessment. But we also realized that since these communities are close-knit societies or communities, at some point there's some form of patronizing, whereby maybe a friend is being identified as a potential host family because of the expected gains. So we did our own assessment, we did our own consultations, and some families, of course, advanced to the next stage. Some other families, we had to drop them because we are not quite satisfied with them. And this assessment took into consideration the different dimensions of the needs of a child. We looked at the protection needs of the child. We looked at the overall environment of the child, the family's income, ability to care for the child with or without support. And we made it clear to the families that there was no support that they needed to expect. If perchance support comes their way, then it was well and fine. So based on these, the families accepted to become host families to work with the project. So the accommodation also looked at the accommodation facilities, children's routine activities within the family, and then access to basic social services, most especially food and medical facilities, and if children are attending school or not. We also took into consideration similarities. For example, similarities in religion, similarities in culture, similarities in language. These were also factored in the assessment. But at some point, all these criteria were not all these criteria were met at the same time, but at least we gave concession to families that were able to meet most of the criteria. Then the second step was to confirm that in order to confirm that the potential foster families had no criminal record, no criminal background, each family that was selected was asked to provide 3 references at the community level, and we conducted reference checks with these identified referees, and all the reference checks proved satisfactory. Then the next stage was to conduct more background checks, still to make sure that the families that we are working with are really suitable in terms of the safety of the child. So police background checks were conducted. But this time, we made it clear to the families that they also had a stake in the project and that they also need to play their part. So for the police background check, all the associated fees were borne by the families themselves. They paid for the background checks, and after successful background check conducts, each family was issued with a police certificate. And then the last stage was to apply for endorsement from the Ministry of Gender, Children and Social Welfare. So as a project, since we are working with the government, we ensure that government takes the lead in all processes. So for the application to the Ministry of Gender, Children and Social Welfare for recognition of these host families, I made use of the regional social welfare officers to write the application on behalf of the project and tender it to the ministry. So after this, the host families, the applications were approved. The ministry sent us an approval, and then that began the operationalization of these host families, and placement services actually began. Next slide. Okay. So equally important is building the capacities of these families, because during the assessment, we tried to sound of course, the assessment, which was led by Save the Children together with the government social workers, some members of the community, and some other stakeholders. So from the assessment, we sounded the opinions, or the assessment also contained questions on the knowledge of identified families on child protection. So we realized that there were knowledge gaps, there were competence gaps among quite a number of host families. So as a result, as a remedial measure, trainings were provided for the foster families, and these trainings looked at child safeguarding, child protection, case management, needs and specificities of children and youth in mobility. And it also looked at psychosocial support to children. So all these were part of the training. And these trainings were conducted on by monthly basis to make sure that most family members are always on top of evolving child protection issues. So at every point in each training, at least 3 members from the host families were invited. We invited some members of the community, invited some members from the mobile teams, some members from the state structures, all to ensure that we have ownership of interventions at community level as well as at national level. So from the training, even before the trainings, after the assessments were concluded and the families were finally selected, then we went back to the community. Myself, together with the government social workers, convened a community meeting to formally introduce the selected families to them. And of course, to seek their blessings and to explain the exact role of the families that were identified and to solicit their support to the host families throughout the project cycle. So so after all these were done, then the families were trained on the various areas of the protection of the child. And of course, during the assessment, we also realized that we also identified the needs of the families. And for most of the needs, they were in need of bedding materials and of course food assistance, because yes, since it was I mean, the becoming a host family was purely voluntary, but of course, since there'll be added children to the host family, there was also a need for the project to support them to be able to respond to the needs of a child placed under them at any point in time. So that's why on a bi-monthly basis, each family is given some food items, sanitary and hygiene items, some food items rather, to be able to prepare them for the arrival of children, because we cannot determine exactly when a child would come. But also there are peak periods when we have more children coming at the same time. And there were times whereby host families used to be overwhelmed with a growing number of children arriving at the same time. So each family was provided with an initial assistance of food items and bedding materials, mattresses, and so on and so on. And subsequently, every 2 months, they were given the same supply still to improve their caring capacity for children. Next slide. So the fifth step is the placement of children and follow-up. So after the trainings, the families knew about child safeguarding, knew about the consequences of violating the rights, the protection needs of children. Then placement services began. And then, of course, these placement services are again informed by the care protocol that was developed. So for the placement proper, it was done in conjunction with the Department of Social Welfare through its regional social welfare officers. We also had a child-friendly space that was part of the placement. The child-friendly space, which has ceased operations since December 2022, was managed by a CUPI, an Italian organization. So Save the Children signed a memorandum of understanding with a child-friendly space for use of the complex to conduct more in-depth assessments of the needs of a child. So it was more or less used as a transit point for children and youth. Then we were also working with SEDAG. SEDAG is a subsidiary of the West African Network for Children on the Move. And SEDAG was hired by Save the Children to provide family tracing and reintegration services on behalf of the project. Next. Next slide. Next slide. Okay.
I
So
think you have to go back one
in terms
slide.
of accountability,
Begin
because
where the
it's
mobile
important
phone
to
comes. The mobile phones.
yeah, the previous slide, yeah. So in the interim, in terms of accountability, just to make sure that the views and concerns of children are heard and taken care of, as in the previous slide, we recommend the second previous slide, the second one. So in terms of accountability, just as I said, to make sure that children's voices and concerns were heard. The previous one, please, the one before this, were heard by the project team in conjunction with the government representatives here. The project decided to buy simple mobile phones that were given to the host families. And this mobile phone concept came in as following a risk assessment that was conducted for children placed in the host families. And we agreed jointly that there was need to provide them with some form of accountability mechanism, in addition to suggestion boxes, having numbers of the project officer, numbers of other child protection actors, the national helpline, green line 119, yeah, for children to call whenever they have a protection concern. So each family was given a mobile phone so that whenever a child comes in, the mobile phone is given to the child and the use of the phone is explained to the child. So at any point in time, if a child arrives in the house, the head of the foster family makes the phone available to him and lets him know that the phone is to be used for the child's private conversation, if need be. So these conversations range from talking to the project team, the government, social workers, members of the community child protection committees, the national helpline, and even sometimes talking to their family members whenever the contact details of their family members are traced. The use of the phones has been one of the provide mechanisms for risk management in combination with interviews. That is to say, whenever the project team conducts monitoring visits to the host family, we do have interviews with the child. We do have one-on-one discussions with the child, one-on-one discussions with the head of the family. We do have group discussions with the children, the host children themselves, to understand if the child is giving them any problem or if the child is being put to any form of harassment or any form of protection concern. But also we do our own observations by reading the child's body language to understand if he or she has been or has gone through any violation of his or her right. So all these things were looked into during the monitoring visits, in addition to the phone calls that a child is able to make. So we made it very clear at the beginning that hoster families should allow children to use the phones for their private conversations. And if there are any issues that we feel is a red flag, we do not hesitate to reach out to the family to talk about it in a very friendly manner. And since the start of these host families, a survey was also conducted, a follow-up survey was conducted with focus group discussions targeting migrant children, targeting children from the host families themselves, targeting members of the project team, and so on, to understand their perception about the use of the host families, to understand their perception about the use of the mobile phones, the pros and the cons, and what can be done to mitigate some of the concerns that were raised. And just as in the slide, follow-up is regularly conducted to evaluate the adequacy of the foster care. So sometimes myself, sometimes members of the community child protection committees, sometimes the social workers conduct spot checks, unannounced spot checks, all to ensure that the child placed in the family is in safe hands. So this is also another form of accountability and transparency of our interventions. Next slide. So from the assessments that were conducted with regards to the use of the phones, it's possible for children to make direct calls to the team, to their families, and then during those calls, if there are any red flags that were raised, then we are able to move in time to make sure that those problems raised were addressed as soon as possible. With the caregivers and the foster families themselves, sometimes the caregivers are also at liberty to speak with the project team when there is need, or when the child has some problems, because sometimes some children come with medical conditions. So when those medical conditions are at play, the family calls the project. In the absence of the project officer, they contact the government social worker or even the police child welfare officer, because we all coordinate together to provide the needed services to the child. So if it is a medical case, the child is taken to the health center by any individual that is available at that point in time. But of course, every other person within the structure is in the loop, knows what is happening at any point in time. And we always make sure that the government representatives are always at the center of our interventions. Next slide. Okay, conclusions. Of course, the presentation might not be exhaustive, but we came up with some main points. And for the whole project, we've been working from the beginning of the project. We've been working with 8 families. Initially, we planned to work with 10 families, but after our assessments, we realized that there was need to scale down a bit. And then we ended up working with 8 families that were trained and recognized by the state. And out of these families, 5 are male-headed and 3 are female-headed. We were striving to get equal male and female representation. But of course, in our Gambian context, most of the time, even women themselves give preference to men. So that has been a problem. So we're doing our best, but it's quite difficult to break those gender barriers. And for the entirety of the project, 251 children were hosted in their host families from February 2021, when the families began being operational, up to March 2023, when the project stopped giving direct assistance to children. So we had 251 children. But still now, our mobile teams are receiving children and placing them into the host families, but this is not taken into account by the project because we have stopped our interventions since March. And as we said before, a formal protocol in order to define clearly the roles and responsibilities for each stakeholder at community level, institutional level, and national level, and also to clearly draw the referral pathways are all in place. For example, to help us to further formalize the referral process, say the children came up with a referral pathway that is clearly put in the form of a design and then distributed among all the partners, the stakeholders that we are working with, so that we are all at the same level of understanding when it comes to the referral of children. So anytime a child is identified, the referral pathway is always there to ensure that the child is in safe hands. So as I said, if the child is identified by anyone, the child is referred to the mobile teams, then ultimately the child is referred to the host family or to the child-friendly space for more in-depth assessment of the needs of the child. So overall, the host family system had been a concrete answer to the growing needs of children and youth in mobility, especially when it comes to placement and food services. And also at community level, at the level of the state, state authorities are really happy with the setting up of the host family system, because at the beginning, that was well before the introduction of the project. Whenever a child was identified from the community, the only place was to refer the child to the police station for accommodation services, not to talk about food, because sometimes the police have no food to provide to the child. So the child would spend their whole night at the police station, sometimes in the police detention facility, where you have some male offenders having to stay in the same location with the child for 1 or 2 days while family tracing efforts are being conducted. But with the introduction of the project, anytime a child is identified by the police, they would call the project straight up, or the social welfare officer, to ensure that the child is moved to a safe space. But also to bring to your attention that the mobile teams, the host families that we've been working with, were strategically identified to include members of the police force, members of the community, the education sector, the health sector. All these are meant to facilitate referrals for the project, so that at any point in time, if we need the services of the police, we have a police representative who could support in this regard. Likewise, if the project needs the services of the medical sector, we always have a medical personnel within us who can support in the referral. Next slide.
Leo, thank you very much. Thank you very much. We have run out of time for this segment. We have to open up now for question and answer, because we have a lot of interesting questions which are on the which have gone on the chat. So we after this very elaborate presentation from Aliu in terms of what has really been happening on the ground, I would like to call on both Aliu and Jose to put on their cameras as the panelists as we go through the questions we have. Very interesting questions which we have on the chat, and hopefully it's still an opportunity for you, the panelists, to explain a little bit more, but we do have quite a number of questions. So I'm asking you to be very, very quick on the point, to be able to cover those questions. So the first question I would give is, we have is, in many countries, governments find it very hard to recruit enough foster families to roll out large-scale foster programs for children on the move. How has Gambia managed to recruit these foster families or host families? I think you said you had 8 of them, and could this now be scaled up going forward? Is there a sustainability thing? So quickly, like in a minute or so, if you could give us that answer as we get other questions.
Yes, thank you very much, Jose. Sorry, Geoffrey. Yeah, as I said at the beginning, we had our meetings with the various actors, especially with the country's Ministry of Gender, Children, and Social Welfare, and we had a detailed introduction of the Protection Project. And then when we had the blessings of the ministry, then they also referred us to the structures on the ground at community level. And as a project, we worked through also not only with the community child protection committees at community level, but also made use of the local area councils for each area that we are working with. And we also made use of the traditional chiefs and even the religious leaders that were on the ground. We made sure that we reached out to each of these people to introduce the project to them and what we want and also their role in the project. So this actually gave us, and the involvement of these stakeholders from the start, actually, I think actually gave us that leeway to be able to have the families. So let me say it is actually within the community, and now there are more families that are even interested to become host families.
Okay, okay, thank you very much. We go to the next question. This could be answered by you, Leo or Jose. Do you have any data on what usually happens to children, when they return to countries of origin and to their families? And then what about children who, have you come across children who you have failed in tracing after a considerable period of time, or who return to their families is not considered to be in their best interest? So one part is what happened to children when they return to their families. Do we get that information, or do we have it? And secondly, did you come across children who reunification with their families is not in their best interest? And if so, what happens to those categories of children?
Thank you, Jeffrey. I just say some. Ali, go, please.
Okay. In terms of data for children to other countries, actually, we don't. It's difficult for us to make follow-ups with children that are returned to other countries. But we are working with like-minded organizations. For example, in Senegal, which is a neighboring country to the Gambia, where we work with ENDA in terms of referrals. Whenever we have a child and we are unable to trace the family, we hand the child over to ENDA. But we've not been able to get up-to-date data about the conditions of children. But of course, we work with the authorities in Senegal, but in other countries like Guinea, after the reintegration, because we don't have partners there directly, so it's difficult for us to make follow-ups to the conditions of those children. But for children on internal mobility, especially Gambian children who have been returned to their families of origin, most of the time we do follow-ups. Even before the child is reintegrated into the family, we make sure that an assessment is conducted by a social worker. And when the conditions prove satisfactory, then the child is returned to the family. And even after monitoring visits are conducted, either physical visits or phone calls, to make sure that the child continues to be in safe hand. And of course, there have also been isolated cases of children whose families were unable to be traced, because most of the time we don't get clear information from the children themselves because of the conditions that they have gone through. Sometimes when you approach them, it's difficult for them to open up to you. Sometimes they keep on misleading, they give you false information, fearing that they might be returned to where they came from. So we've been having those isolated cases, but mostly when we are at a deadlock, we have to go back to the government and refer the child to the government shelter that is in Bakote to further support in tracing the child's family.
So, and then, so in that case, you're saying children who you are unable to trace within the project time frame, go to the government shelter. Is that
that
so?
has been isolated case, and it's not more than 3 cases. So okay. We work in close. Yeah, and sometimes also when the government also is unable to identify a child's family, they also refer the children to the project, especially children from the regions in the country. They refer them to the project, and then we also support layer integration. So we have that understanding with the government. So for the last one also, said we do conduct assessments before returning the child to the family of origin. And so far, the assessments that we have conducted in the Gambia and the follow-up visits with the phone calls that have been conducted with the children themselves, with the parents of the child, of the children themselves. All these proved that the children were in safe hands, because sometimes we even conduct spot checks to make sure that the child is really in a very safe environment. So far we have not had those cases. Our only limitation is that we are unable to monitor the situations of children that have been moved to other countries, especially Mali and so on.
Thank you. So maybe we can go to Jose, since you have indicated that this is a cross-border project covering 3 countries. Jose, do you have any data sharing between Senegal, Gambia, and the third country where the project is, and sharing information cross-border? Jose?
Yes, Jeffrey, thank you. Actually, I don't have the full picture, I'm sorry, of the whole project, but we can say that technically the coordination between the other countries has been coordinated by the regional coordination units. And the data, I don't have the availability here to show and to share with all the colleagues, because we still are defining and reassigning the capitalization of the results, but it's quite pretty similar.
Okay, thanks.
Thank you.
Because the other question was, we are not sure what percentage of children are returned to other countries other than Gambia, because from Aliu, the family assessment in Gambia is done, but we have a question in terms of coordination, what coordination is happening with authorities and social workers from the other countries where the children are from, to ensure that there are proper assessments, whether it's in the child's best interest to be reunified, and what kind of support might be needed or provided. So that little bit of information is one of the questions coming.
Okay. Yes, Aliu?
Let me just quickly comment to mention that for the project countries, that is Senegal, Guinea, and Cote d'Ivoire, we have not had any case from Cote d'Ivoire actually. But whenever we have a case from Senegal, we liaise with our counterparts in Senegal, but we also liaise with ENDA and AMO, that are non-governmental organizations working towards child protection, to coordinate together for the safe return of the child, either to Senegal or whenever the child is coming back to the Gambia. So for the project countries, we have that coordination, and we also have this regional coordinating group that works. That is being spearheaded by Save the Children, and responsible for coordinating the return of children from the respective project countries, but also some other countries like Mali, especially during the COVID-19, the return of Gambian children, Senegalese children from the other countries. So we have this level of coordination between us as a project team, but also between us and the other non-governmental organizations in child protection. But in terms of data, that's actually something we need to look into. Maybe Jose could come in.
Okay, I think that covers for that now.
Okay.
We have another interesting question. Aliu has already told us about the mobile phones and what it does, but we have a question about care concerns. Can you please share how you manage standards of care? Any complaints and allegations against the host families? What worked? What are the challenges or areas of development or opportunities to improve? You did tell us that you get some calls from the children using the mobile phones, but the question is, if there are concerns around care within the host family, what kind of complaints did come in, and how did you deal with them?
Actually, to be frank with you, we've not received any major concerns from the children. The only concern we used to have is mostly petty theft, when these children placed in the host families would steal from the host family. Sometimes they would beat children from the host family, but the heads of the host families are so careful that they don't want to put these children placed under their care at any form of risk. So it's the children instead who would beat or abuse other children. They would beat them. Sometimes they would steal from them. And then when these cases are reported to us, what we do is I have to go around to move the child to the next host family that does not know about what has happened. And then the child would be supervised and ensure that the child is returned as soon as possible. But in terms of abuses against the child, we've not had any major issues. So the only challenges we used to have as in terms of language differences, because sometimes we are forced to select families that are unable to speak the same language with a child. Or sometimes the other host families are overwhelmed that we have no other choice but to move the child to another family. So sometimes we have that language difference between the child and the host family, unable to communicate. But as the child continues to stay there, he's able to communicate gradually, he's able to learn the language of the family is also gradually able to learn his or her language, and eventually they're able to at least pick a few words to communicate.
Okay, thank you very much, Aliu. We have another question on sustainability in respect to now that the project has ended and you have got this host or foster family system. Is it continuing to function now? Because it was, you said it was linked to the government, and if so, how are they being supported by the authorities? Yes.
Yes, actually, since the project is phasing out, we had let me say the government is already in the loop of what is happening, because we have government involvement in each and every activity of the project. So already they are aware of what is happening. So we also further engaged them about the future of these interventions that we have made. So for the host family system and the mobile teams, they are here to stay. And the government made it clear to us that they will make sure that they integrate them into existing government programs to make sure that the interventions are sustainable. Even right now, the government is working on having a child-friendly space here in one of the project zones to ensure that the good practices that are going on are able to continue. And the communities themselves to continue, although the mobiles, for example, that we are working with are not working regularly as they do. Now they do consultings from time to time. Randomly, they identify children and provide them with the needed support. But for the rest of the interventions, all the structures are linked with the government. For example, we have an existing social protection program, and we are working closely with the government to make sure that the host families, especially, are integrated into this existing social protection program, which entails cash transfer. And if this comes into play, and you realize that at least the families would have a means of supporting the children. So even for now, children are being continued to be placed into the host families. So there's something that will continue, because already it had been existing even before the project. The host family had been existing, but not formalized. Likewise, the mobile team. So the project came and formalized them. So even without the project, it still continues.
There's a directly related question here about government support to the host families. Since the project was providing supplies like food and clothing for the children, can you, is the government already providing some direct support to the host families? Or if not, are there plans to give some financial support to these families for the support, for the work, the good work that they are doing?
No, the government actually, they made it very clear to us that they do not have any budgetary allocation for the host families. They are resource constrained. So they are looking into possibilities of funding the host families, but it's actually a problem. So let me say, the only possibility for now is to include them into the existing social protection programs to ensure their sustainability. But even before the inclusion of these families, the families are still active. They are hosting children. Just recently, there were a number of children that were hosted by the host families. And the mobile teams are also conducting, not regular, but they're conducting outings from time to time. So already, let me say that these were there before the project. We came, formalized them, built their capacity to be more functional. And we've also been looking at ways for them to be able to generate their own income, because these structures that we are working with are part of the Community Child Protection Committee, which looks at the overall protection of children at community level. So we have the hope that if they're able to generate their own source of income, that will also help a lot in their viability and their sustainability. So we are looking at this, and already we're working with government in this regard.
Great, Aliu. Thank you very much. There's one more question. In terms of, you did mention about training, which you provided to the host families. So did you have a curriculum for the training of the host families? And if so, how can one get the content of that curriculum, which you use for strengthening the host families?
Okay, I didn't get the first part, but I think it's about
the idea is
if there's a training curriculum.
The training curriculum for host families, yes.
Okay. Yes. Let me say that the trainings that we have all been we've been providing to the host families. Of course, these trainings were conducted with support from our child protection technical advisors. For example, we used to have support from our technical advisor in Spain, who linked us with the is it the Balkans, the Balkan model, and we were using the Balkan model to provide our trainings to the host families, which was contextualized. But also, we do have, as part of the project, we do have a pool of trainers at regional level. And from the Gambia, we have 6, and myself, I'm the backup. So periodically, we do attend trainings. And whenever we attend these trainings, we are expected to cascade them to the various structures that we work with. So the host families are targeted for these trainings on child protection, trainings on case management, which is very central in the operations of the host families, but also trainings in psychosocial support. So already we have these that are ready-made and are standard. So it's the same that we use throughout our training. So they already, let me say, we already have a curriculum that we use.
Okay, thank you, Aliu. Final question in a minute, because we have run out of time again. How did you ensure that children's voice was sought and given due weight in your project planning, care planning for the children, and supervision? And any learning from that which you can share from us, so that make that as your last question, and I will also give opportunity to Jose to give us any other highlights as we close this time of question and answer.
Yes, of course. Children's participation in our programs it adds to the quality. It adds to quality delivery of our programs. We do this through various forms. For example, of course, use of the mobile phones is one, but also when we place a child at the child-friendly space, we have dedicated rooms that are rooms for listening, hope rooms, and then we also engage the children in recreational activities. And during those recreational activities, we observe their behavior, we listen to what they say, we listen to their concerns, but also when children are playing within amongst themselves, sometimes we also observe, we also talk to the other children, and they will tell us what the children being hosted are saying. So we also engage the children during our assessments. For example, we do conduct periodic rapid analysis. We also, whereby we engage groups of children in focus group discussions, one-on-one interviews, both children from the host families, as well as children and youth in mobility. And in some of our activities too, for example, our sensitization activities, we also make sure that children participate very well. For example, we do organize activities such as Run for Children, Run for Peace, Jacarlo, whereby children would have conversations with relevant authorities to voice out their concerns and together to look for solutions to improve on the protection of children. So all these various media for children to express themselves. And sometimes we also conduct radio programs where children are given the platform to talk about issues that are affecting them. And when we also conduct monitoring visits, we consult them and they would talk to us. So all these are various media whereby children will participate towards ensuring quality in the project.
Thank you very much, Leo, for the wonderful responses you have given. I will give one last chance to Jose to give us any highlights, especially in terms of recommendations and way forward. Anything you can share with our webinar participants?
Yes, thank you, Jeffrey.
From where you said thank you.
Thank you so much. Yes, I could say that, for example, one of the most important things for us always has been the coordination between areas and between countries. Contribute an efficient monitoring tool for us, the coordination as a cross-border project. It's not only for the family, for the whole team and the trainers. Also, the cross-border coordination I said before, because this is really important how Thailand in particular, we established a task force that Ali was explained before. And for me, the perception of the family and the acceptance has been very, very important and relevant to contribute to strengthen, let's say, the community outreach activities. Raising the awareness around the protection system is very important for us because, nowadays the migration route is quite challenging, and we saw at the beginning many elements has been put in place, like climate change nowadays, like conflicts and food insecurity. For me, that could be the main highlights. Thank you.
Thank you very much. Thank you very much for that. We would also like to thank all our participants for registering and attending the webinar. As we go to the conclusion of today's webinar, we have got a few information which we would like to be giving out to you, that we will be sending an email with all the links, or with the links from this meeting and all the slides. All people who have registered and attended will receive that. And we also encourage all the participants to join the Transforming Children's Care Global Collaborative, which was introduced to you at the beginning. Please join this network so that we continue collaborating and sharing information on children's care. So just as you have seen on the screen now, in the chat box now we have got the links to learn more about Transforming Children's Care Global Collaborative, please click on that link and join the group where you will be able to continue sharing various discussions on various topics regarding children's appropriate care. We will be sending all the links and resources for this webinar, the webinar recording and slides in a follow-up email shortly, as I've already said. If you have any questions, comments, and recommendations for the future, webinars, please send it to the address which is on the screen now. Otherwise, thank you for attending. And hope to see you soon for the next sessions. Bye-bye.